Hi, today let's talk a little bit about how medications are dispensed, the differences between how medications are dispensed back home where I practiced in Africa and how they are dispensed here. So, back home, it can be done in two ways. One way is that the medications are left at the bedside with the patient. And then the patient's cardex is also at the bedside. So the nurse goes round, since it's a ward, it's not private rooms. The nurse goes round, takes the patient's medications, sign it off on the cardex, and administer the medication to the patients. For controlled drugs, there is a locker where controlled drugs are kept. And that locker, the key is handed over from shift to shift. And most times this happens between the unit managers, the in charges. They are the ones who manage that locker. So if you have a patient that needs a controlled drug, it has to be, there's a book where everything is recorded, you took this amount and all that. It's similar with how it is done here in nursing homes. In nursing homes, they also have keys that they hand over from shift to shift. Then another way of doing it over there back home is there is a cart with medications in it where the nurse rolls around the ward and administers medications to patients. The cart has cubicles labeled with each patient's name. So you go to the patient, open the patient's cubicle, take the patient's medication and administer it to the patient. So that's how the second way it is done. And that is also similar to how it is done here in nursing homes. We also have a medication cart with cubicles, but this time around it is not each patient does not have a cubicle. Rather, each cubicle has a medication, maybe Tylenol, aspirin, or whatever. So you go to the patient's room, whatever the patient is due to have at that time, you open that cubicle that has that medication, or those cubicles that have that medication, pull it and administer it to the patient and sign it off. So that is how it is done back home, specifically in Nigeria, in the places where I practice. Then here, they have medication dispensers. That's in hospitals, long-term acute care facilities, inpatient rehabs, hospitals or hospital settings. They don't have carts like they do back home or in nursing homes here. They have a medication dispenser. This medication dispenser, each nurse is given access logins. You have a login that is specific to you, so that when you enter, whatever you do under your name, you are responsible for it. So with your logins, you gain access. You pull them. There are also cubicles with different medications inside. You pull the medication, you take it to the patient's bedside, you scan it with the computer, and then which is what will record that you gave such medication to such patient at so time. You administer it to the patient. For controlled drugs, when you open the dispenser will instruct you to count the controlled drugs. When you count it, you type in the number that you got there. If it is what is supposed to be, you can go ahead and pull it. But if it is not, it will warn you that the count there's a discrepancy. So you count it again. If eventually there is a discrepancy, it will be resolved by a nurse and a charge nurse, just to make sure that whatever is coming out is accounted for. So these medication dispensers, they are different types. They have different companies have different types, but they essentially do the same thing. You have logins. You log in, have access to it through your login. You pull your medication and log out. So this is what it looks like. So thanks for listening. Make sure to like, share, subscribe, and follow for more.